Hi, everybody. I'm AJ Hanna from Sykes, and this is Ask AJ. Ask AJ is a series of videos that I do where I provide my perspectives, having spent almost 30 years involved in the healthcare industry, and more recently, having been involved in the implementation of intelligent automation and doing digital transformations within a variety of businesses, but certainly within the healthcare environment. And so, uh, Ask AJ is a show where I try to share my views on what I see in the market and where I think there are interesting things that are happening and provide my perspectives, having come from an operations perspective and how all these things affect the way uh, industries and healthcare in particular operate. For those of you who have followed Ask AJ in the past, welcome back. Thank you for joining me again. It's been a while, and I hope over the last several months, with everything that's gone on in the world, that you've taken good care of yourself and those around you, and continue to do so. And so, one of the things that we're going to start off with is talking about where we are today in certain areas and what I think is coming next. So the idea of what's next after all of this is something that weighs heavily on people's minds. And given that where we are today, and this is being filmed in July of 2020, there are still lots of unknowns about whether or not we're going to see a continuation of the pandemic that has impacted all of us in a variety of different ways, whether it be from a professional perspective, from a personal perspective. And it is something that the world is still grappling with. And up to this point, we've seen some very significant impacts in many of the areas that we've talked about before. Certainly from a digital transformation perspective, many organizations having been forced to move people into a work at home environment are finding themselves asking the questions about whether they've done enough from a digital transformation perspective leading up to now. And they're certainly finding more reason for which they want to transition more of their work to a digital environment. Within the healthcare realm, there's an estimate that health systems could lose hundreds of billions of dollars in revenue throughout the rest of the year 2020, having already fighting through caring for patients, having loss of revenue from discretionary services that in some cases were banned during points in time during the pandemic, and certainly there isn't time to regain on a lot of that revenue. In the insurance industry, with the loss of employment by millions of people here in the United States, it certainly impacts the roles that our health insurers are covering. It also doesn't take into account that rates were set well before the pandemic came in place, but we've seen as with the provider community, we've seen the insurance community step up through waiving copays or covering in its entirety any services related to COVID-19. And so the question becomes what happens from here on? And again, I think what we're going to continue to see is an interest across all industry types, and certainly across all the various segments within healthcare, of continuing to try to find a way to transform more of their work into digital, especially when you consider, if you look, for example, in the health provider space, that reductions in staffing are generally coming in the administrative functions. But certainly it's impacting the way everyone works, and industry executives throughout the world are expressing interest in continuing to drive more digital transformation. The concern is whether or not the revenue impacts that the pandemic and the economic recession that resulted from the pandemic will allow them the resources to be able to dive in and invest in a significant way. And I think it will be interesting to see what choices businesses make in the way that they invest or continue to try to invest in programs or technologies that will help them hopefully weather the potential for a resurgence or further impact from COVID-19 moving forward. I think we're going to see more and more people working from home. I think I can remember 25 years ago having conversations about people working from home, and we weren't anywhere near in the have laptops or access to high-speed internet and so on and so on. But those questions have continued even as technology has progressed. But I think what's been discovered, and I think what many people knew but never really took the opportunity to find out, was that it is possible to have a viable, substantive part of your working population, your employee population, working from home. And technology today is such that it makes it much easier to do, and people in many cases are finding that they're more productive working from home. In terms of what's going to happen in the healthcare industry, I think we're going to have to really pay attention to resurgences in the pandemic and the impact that has on care providers as they attempt to try to find a way of closing the gap for the revenues that they've already lost, and that they really won't have the opportunity to recover. For the insurance industry, the question will be, for those who have moved into the unemployment ranks, what programs do many of those people roll into? Do they roll into federally or locally supported programs? Do they move to the healthcare insurance exchanges that provide them with coverage? So does the mix change from employer financed here in the United States, employer financed insurance, to a more self-pay or government funded mix than what exists today, and what are the implications of that? One of the interesting things that has come out of this, and that I'll talk about more in a future episode, is telehealth and the impact that telehealth is having on the ability of people to get care in a remote setting when they don't want to be in a waiting room or in a hospital or in a doctor's office where there are people who could possibly who are possibly carrying the COVID-19. So I think there are tons of things to look at where it's still, even 3-4 months into the pandemic, probably too soon to tell too much about what's coming next. But I think what's clear is that we've learned a ton as a society, as an economy, as a people, about what we can endure and ways that we can respond to things like a pandemic that will allow us to hopefully weather that storm much more smoothly in the future. If you have any questions for me, please feel free to drop me a note at askaj@psychs.com. Follow me on Facebook and Twitter at AskAJHanna, no H on the end, and we'll talk to you again soon.